So here we go. My name is Carrie. I work at Spruce Health, and I'm going to be serving as the moderator for today's event, just so we can guide the discussion in a meaningful way and make the best use of everybody's time. We are incredibly glad that you've joined us today to talk about how to grow your private practice on your terms. We're going to talk about how to embrace who you are as a person, as a professional, how you want your practice to show up in the community, and how to capture your authentic voice. And again, all on your terms. We're going to cover how to start and or grow your practice with the right tools, how to manage workload, burnout, even under appreciation, and how to work more flexible hours, even taking more vacations, all while using your clinical skills most effectively. So buckle up. It's going to be a great event. Okay. Let's see here. There we go. So for our agenda today, let's get down to business. We are meeting Patrick Casal, therapist, practice owner, coach, and strategist. That is a mouthful. And we're going to learn about how he's grown his practice on his terms and helped more than 1,200 therapists do the same thing. We also have Jessica Goulash, sales leader and Spruce expert, joining us today to answer any questions that the audience may have about Spruce. But before we get there, let's go over some real quick housekeeping. Jess just mentioned, but for those of you joining after, please use the Q&A function at the bottom of your screen to ask any questions that you may have. We will address them as we go, but we'll also save time at the end. So be sure to ask away. This event will be recorded and shared with everyone that registered, so do keep your eyes peeled for that. I'll be sending out a link to the slides and the other resources that we'll mention at the end of the presentation. That'll all be coming your way later today. So with that, let's start with some intros. I'm going to let these two introduce themselves, because who better to speak about you than you? So Patrick, have at it. Thank you for being here today.
You're welcome. Thank you both so much for having me on. I really enjoy any sort of partnership with Spruce in general. Sorry to everyone listening that I put in the chat, tell us where you're from, and the chat is disabled. So forget about that. Don't put that in the Q&A, please. That's on me. That's on me. I'm Patrick Casal. I am in Asheville, North Carolina. I am a group practice owner and therapist. I am a private practice coach, a speaker, a retreat planner, a podcast host. I moderate the All Things Private Practice Facebook group. I am the All Things Private Practice podcast host. I hate talking about myself. I just got done with a retreat that I hosted in Asheville, and I've been helping therapists build, grow, and start their businesses for the last couple of years.
Awesome. Thank you for that. And I didn't know you hated talking about yourself. I would have just talked you up, but you did a great job. And then let's meet Jess. Jess, tell us about yourself and a little bit about Spruce for those who don't know about us. Oh, you're on mute.
I'm muted.
Just real quick, someone asked if you can enable the captions. I don't know if that's possible to do while we're talking, but I did just see that come through for anyone who's trying to pay attention.
I'll let Carrie try and figure that out. I haven't seen that setting for us, and we may have to have enabled it prior to starting the webinar, but I'll let Carrie look into that a little bit. But we may also be able to do it for the video recording after. So apologize.
Yeah, I can definitely do it for the recording after. I'm not seeing an option to do it right now. So when I send the link, I'll be sure that that is enabled for the recording.
And again, just to thank you guys for putting in your cities to the Q&A. We don't have chat live on this webinar due to the high response rate. We had so many people, we were a little worried we wouldn't be able to manage the chat. So please put your questions in the Q&A, and you're welcome to put your city in the Q&A as well. But we're going to also try and get a poll out as well at some point, so you can kind of answer that and then the Q&A portion. But again, I'm Jess Goulash. I've worked at Spruce for over 6 years. Helping clinicians across the nation get better communications, more HIPAA compliant communications through Spruce, and better collaboration among your teammates as well. I've seen all the questions, so any questions, feel free to reach out. I don't know exactly how many of you guys are customers or not, but welcome to all of you. And if you don't know what Spruce is, we handle everything from your business phone system, so a phone number, a fax number, desk phones if you want them, or mobile, and texting both by SMS and secure messaging. All types of healthcare communications all in one cloud-based app that you can access on your cell phone or on your computer. And we have a free 14-day trial that obviously anybody can try. So, but if you have any questions about Spruce, you can feel free to ask those too. But this is really this webinar is to get your resources from Patrick on starting a practice and other kind of group mental health questions out there.
Love it. Thank you so much, Jess. And Jess, I'm going to let you handle the Q&A because
I got it.
That's going to be a tricky one for me from this standpoint as well. So thank you for that. Okay, perfect. So with that, let's get into the good stuff and talk private practice. I love this image, mostly because in order to be able to care for others, you have to take care of yourself. And I think Patrick would probably agree with that. And a nice segue into our first meaty subject. So Patrick, I mean, you've done a pretty incredible job growing your practice and helping countless others do the same in what I imagine is probably considered a fairly crowded space. I would love for you to talk to us about that, whether it's, how one differentiates themselves, finding that unique niche, developing your clientele, et cetera.
Yeah, that's a great question. And, I think that COVID has really increased the amount of therapists going into private practice because we all had this kind of universal experience where we were like, I don't want to work for someone who doesn't care about me anymore. And I get that. I felt the same way when I left my agency job in 2017. And it has become a more crowded space, but that does not mean there are less clients who need support. There are actually more clients who need support right now more than ever. The struggle that people typically have, especially in more saturated markets, like Asheville is very saturated. We are a small city. We're only about 80,000 people, but we have so many private practice therapists. But that's the great thing about this is that there is enough clientele and business to go around. And if you can stand out in terms of truly understanding your niche and their pain points, not just I work with women with anxiety. It's really got to be a little bit more nuanced than that. If you can, if you can be authentic and really capture, the experience that your clients are having instead of being very generic, buttoned up. This is how grad school told me I need to interact and how I need to present myself. Those are really important things. And you also have to be able to network, get your name out there and be visible. And a lot of therapists really struggle with this because introversion, I don't know what I don't know. I feel imposter syndrome all the time. Trust me, that feels like my middle name most of my life, even with all the things I'm doing. And that all plays a major part in either I'm not going to even launch and leap, or I launch and leap and I fold up shop because I really don't understand how to run a business. And that is unfortunate because with a little bit of tweaking here and there and truly understanding what brings clients in the door, it could be wildly successful. And when I started my practice in 2017, I didn't know what the hell I was doing. All of my coaching has been developed around what I didn't know and what I made mistakes on. And I owe everything that I have right now, everything that I listed in my title, to getting out of my community mental health job and starting my private practice and taking that risk.
That is interesting. And we do have a quick poll. I'd love to actually throw that up real quick because we are interested to know where folks are in their practice stage, if you will. So we just threw up a quick poll. Yeah, I see folks are answering it, and that'll help us too, because then we'll know, how to read the room and really what to expand on it. So right now, I don't know if Jess, if you and Patrick can see this, but what I'm seeing is that the lion's share of our audience is in their own practice, but wanting to grow and learn. 77% are in their own practice, but wanting to grow and learn. 12% work in community mental health and 12% work at a group practice. So thanks for that. Thanks for answering, guys. That's pretty cool. And let's see, maybe I can share these results and now you guys can see it.
Yeah, there, we can see it now.
Okay,
Cool.
brilliant. I had to end the poll in order to share it. So So that's good stuff. Thanks for answering, guys. It's great insight. Let me close that out. So, it's interesting, Patrick, you touched on virtual, versus in person, and how obviously the pandemic has shifted the landscape. Do you feel like it is perhaps forever changed now? Or, do you think that there's now just more opportunity for a hybrid where you can do both and it's more accepted? From what I've heard it's a nice opportunity for therapists to finally get to travel, be wherever they want to be in the world and still maintain a business. But I'd love your thoughts on that.
Yeah, it's a good question. It's layered because some people were yearning to go back to in person even when the pandemic was really raging. And I'm not going to cast judgment on anyone for what they value and how they want to run their business. So that I think in-person therapy will always be around. However, I don't think teletherapy is going anywhere. I think it's going to be more and more the norm as we move forward throughout our careers. And we're certainly going to see more hybrid practices pop up. And I think we all get into private practice ownership and becoming an entrepreneur for a lot of similar reasons and values: travel, autonomy, freedom of schedule, make more money, work less hours. I can go on and on and on. But what I can say is that my group practice is 90% virtual. I have therapists from all over North Carolina. And what it does is not only does it allow you to be more accessible to your clients, but it allows you to market in different locations as well and just do equally, if not more effective work, is what the research shows. I know some questions will probably pop up about what is insurance going to do about telehealth. I cannot answer that, as every state is so specific and different. However, we are seeing a shift. We are seeing insurance companies start to offer blanket coverage for telehealth. Sadly, we're also seeing insurance companies start to say, if the only way we're going to do telehealth is if you're platformed through MD Live or something like that. And that is unfortunate, but that's not everything. And I think we so often get into this black and white thinking of one insurance company is doing this thing, that means everyone is going to do this thing. And that's just not true. So here in North Carolina, Blue Cross Blue Shield was already paying for telehealth prior to COVID. Now, there are plans that don't, and it is a navigation of deciding, do I want to be insurance-based? Do I want to go private pay? I saw some questions in the chat about how do I track private pay clients, and I can talk about that too. And someone asked about how do I pay my clinicians so well? And I can answer any of those questions, and I don't know if we want to do that later, but ultimately what I will say is telehealth is accessibility. Telehealth means that someone who lives in rural North Carolina can access services. It also means for people with marginalized identities that they can find therapists who look like them, who identify with the same orientation. When in a small town in North Carolina, for example, they may not be able to have an option for who they see. It may just be, we have one therapist in town and that is who everybody sees. So accessibility is huge with telehealth. The ability to work remotely, the ability for a client to see you from their office, from their home, from their car, and hopefully not driving, but sitting in their car. We can get really creative with how we do therapy now. And I think that it's really exciting. And, I do not think in-person therapy ever goes away, but I do think that telehealth is definitely here for the future.
I have some good telehealth questions that came through, if we can kind of address those.
Yeah.
Sure.
So lots of questions. Thanks everyone for the questions, because I always like to encourage them. So I have to thank you first. So a couple questions about cross-state telehealth. Like one said, what about telehealth across state lines? I know this has come up when I've been talking about telehealth with Spruce. So what's your recommendation there? Someone else said about how you also find information about telehealth in different states.
Yep, great questions. And those will continue to shift and change. I know there was a lot of misinformation as COVID started, where we were able to do telehealth with anyone from anywhere because of the pandemic. We lifted a lot of restrictions. You could do telehealth on FaceTime, you could do telehealth on Zoom, etc. We're no longer in that space. I still consistently see people putting that information out there, and that's just not accurate. With PsyPact passing for psychologists and a lot of people who are PsyDs, you have more ability to now work throughout the country in different states where PsyPact has passed. Now we're getting into a place where Council Compact is also about to pass, because we've gotten the states signing off on it. So that will mean those of you who are licensed counselors will then be able to see clients who are a part of that compact in those states. We're not there yet, so don't start doing it yet. There are also states that said no. So in order to find out if you can work with someone, the general rule of thumb is you can be anywhere. And some states are like, you can't. You have to check in with your state board. And again, this is very nuanced because every state and every license type does things so differently. However, most of the time you can be anywhere, but your client's feet physically have to be in the ground or on the ground in the state that you're licensed in. Now, if they're traveling, you have to actually call the state they're traveling to and find out from their board if you can see that client. You also have to get some sort of correspondence or written communication approving that to be able to happen. So it's not as if I can see clients in California right now. If I was in California, I could see clients in North Carolina, however. So it is very complicated. And it can, you can really see how this can start to become a bit confusing and overwhelming as we do not have uniformity throughout this country in terms of mental health coverage.
Yeah, right. That is confusing.
Huh. And so what do you have a recommendation for a resource like for them to look up, or is it just they have to look up the specific state and then the telehealth in that state?
It's really honestly the specific state. You've seen some spreadsheets getting passed around in different Facebook groups, but again, I question the accuracy of those things as we move through time.
Right.
And you really want to be safeguarding yourself. So ultimately, you really do need to be contacting the board in the state that your client may be moving or traveling to.
Great. Another question kind of related. Are you finding that, this is from someone saying, do you feel rates are higher for in-person compared with online? This person happens to be in New York.
No, I don't find that at all. I actually find them to be either the exact same. You're providing the exact same service. I have a lot of telehealth practitioners that I work with doing coaching whose rates are very, very high, and are complete telehealth practices, and they have absolutely no problem filling their spots.
Awesome. Okay. So those are the kind of telehealth questions that I saw. And then there's just some other questions about, you mentioned, you mentioned on your podcast, as well as just a few minutes ago, that you pay your clinicians very well. Mm-hmm. And this person said, is this because of your other incomes, thus the profit from your practice can be minimal? I'm starting my own practice. I'd love to do a 70% average to determine W-2 wages, etc. split, but the economics don't support it. I'm in Virginia. I hope you understand more of that than I did.
Yeah, I understand that perfectly.
That's from
so my practice, again, is mainly telehealth. So we do not have physical office space. We do. It's very small. It's very affordable. So that eliminates a significant overhead that we do not have to pay for. So therefore, I can pay my clinicians a bit more. I also am of the mindset that if we pay people well, if we treat people well, if we show appreciation, considering most of us never really received that in our agency job settings and in some group practices, unfortunately, that the clinicians are going to be way more invested, not only in the mission of the practice, but also in terms of taking care of themselves and doing good clinical work. And that, in my opinion, creates profit going down the road, because you're going to have less burnout. You're going to have less people turning over and transitioning out or quitting. And you can still make money. It doesn't have to be as absorbent as some practices who may do like a 40-60 split or whatever the case may be. Now, W-2, it's going to be very hard to do 70-30 because the taxes just don't support it. As the employer, you're paying all of the taxes and expenses. But you could certainly adjust to 60-40, 65-35 and make that work. It really is about what is the long-term vision. And I was willing to sacrifice profit knowing that my employees would be taking or treated well, therefore probably going to have more longevity with my group practice and ensure that they are doing better clinical work, creating a better clinical reputation in the community.
Nice.
There's a lot of questions coming in. So why don't we continue on maybe then?
Yeah, that sounds good. And we'll just kind of pace them out and continue to answer them as we go. One thing I wanted to just quickly touch on while we're still on this slide, Patrick, as you'd mentioned it at the onset, was that for a lot of folks in this space, they don't necessarily know how to market themselves, or they may not be comfortable with that aspect of the job. And I completely appreciate that. So, I mean, what are some of those necessary things that you have to put into place to both promote yourself and then, of course, to ensure a good experience once you start to see that traffic coming in?
Yeah, that's a common question and a good one. So, therapists, including myself, notoriously don't understand that we have to invest resource into our business to create a functioning business.
Mhm.
And we kind of assume I'm going to slap together a psychology today, it's going to be up and running, and why am I not getting phone calls? And I would say that that is just one very, very, very small piece of the puzzle.
Mhm.
In this day and age, especially in the telehealth era and an online era, we need good websites. Your website has to be good. It has to be generating traffic. If you can't afford a website at first, then you have to niche down and network your ass off.
Mhm.
If you don't understand who you're marketing to, and that's a big thing too, and we don't have time to go down the like therapists that hate marketing and networking, but you're running a business, so you have to treat it like a business. And that means you do have to have a marketing strategy. That does mean that your community needs to know that you exist and that you're open. Think about restaurants. If you don't see them posting new menu updates or new hours, or they haven't posted in 6 months, your assumption is probably that they're closed. If you look up a business online and they don't have a website, the trust in that business goes down significantly. And your website is essentially your online storefront, a glimpse into who you are and how you work.
Yeah.
And without one, it is just very, very complicated. And even more so if you don't know who you work with. If you're a generalist, and some of you who listen to my podcast may hear me say that you cannot be the Applebee's of therapy. I'm going to trademark that one day. You just can't do it all. And you are not going to get private pay clients if you don't know who you work with. Why would I call you if you're just saying I'm a trauma-informed therapist who works with A, B, C, D, E, and F? Like, you don't stand out from anybody. But I will call you if you say, I specialize in supporting neurodiverse entrepreneurs who struggle with perfectionism, blah, 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 blah. I'm much more likely to call you if you can speak the language in terms of how I am experiencing my day to day.
Mhm.
And if you don't stand out, if your entire website looks like a resume, if you talk mainly about where you went to school, what theories you use, what interventions, what trainings, I'm clicking to the next one. Our attention spans are so short. We do not want to read about that information. We want to know that you get the struggle and yet you can help me.
Love that. That makes perfect sense. That's great. Thank you. Okay. Well, for the sake of keeping things moving along, because we have so much great content, I'm just going to keep going. So what burnout feels like? Here's another good one. Work nonstop, and then you panic about all the work you have left, and you try to take a break, but then you keep thinking about all the work you have left, which is a great segue into this slide. Managing workload and burnout and even underappreciation. I would love to hear your thoughts on this, Patrick. Obviously, I mean, this is something that professionals, I think, across the board, across roles and industries feel at large. But I have to believe that in mental health, it's a whole host of unique issues, from, the long or unconventional hours to the challenging and emotional situations and beyond. So talk to us a little bit about what you've experienced and how you've overcome some of these challenges.
Sure. Yeah. I mean, our profession is hard, and the last couple of years have made it harder.
Mhm.
And notoriously, we do not practice what we preach in terms of self-care. And I do think self-care is a privileged term. I don't think we all get to just like go get massages and go on vacations and step away. But self-preservation is absolutely necessary in this field. And that means sometimes having to turn away clients. That means getting really comfortable with a schedule that you're not overextending yourself. That might mean raising your rates so you can work less hours and you're not seeing clients 8 p.m. on a Saturday when you don't want to be working. Because ultimately, if we can't take care of ourselves in this type of work, you're not going to want to show up. You're going to look at your schedule every day and just cringe and just be like, oh, can't this be over before it started? Instead of feeling really energized by the work that we're doing. And so many of us just feel like we can't step away from our clientele or our caseload to take vacations, to take a few days off. I hear a lot of you struggling to even take a sick day or a mental health day. as if like I have to sacrifice my well-being for my clientele. And that is just not modeling healthy behavior in terms of being a human being. And if we can't do that, it is so hard to not feel like you want to switch careers or that this is just not work that fulfills you anymore. And when I hear this, we start to see a mass exodus towards coaching of like, if I could just do things without as much restriction. And yes, that's true. But if you could just get your business under control and create something that actually works for you, the feelings of burnout really subside. And that doesn't mean the job gets any less hard, but having good support systems, having good consultation, having coaching, having mentorship, like having systems. Can't tell you how many therapists I work with that just, their systems are so erratic and like don't know how to do intakes or send paperwork or schedule, and like struggle to talk about money, struggle to talk about all of the things that kind of have to go into keeping the lights on. And imposter syndrome is obviously a major factor as well. I talk about that all the time. So there are lots of strategies to prevent burnout, but it is about, like you said, managing workload, because if you can't, it's really hard to have capacity or clarity or energy when you're just going nonstop all the time and just never stepping away.
Yeah. Well, and I know, I mean, not to be too self-indulgent here, but I know that you have leveraged Spruce to kind of relieve some of that workload and even ensure the sort of the seamless communication with patients and colleagues alike. Can you tell us just a little bit about that and how you discovered it and if it has in fact made an impact on the way that you work?
Yeah, definitely. I've been using Spruce for years, and now that we have a medium-sized group practice with 10 clinicians and a psychiatrist, we're very busy. And to have the ability to have auto responses on phone trees, it comes back to efficient systems so that you don't have to be checking your phone after hours and responding, so that you can have systems in place so that your clients are still being communicated with, but it's not directly from you. And making sure that it feels really seamless so that you don't have to be scrambling in between sessions to have certain conversations. Like we have after hours messages, we have auto response messages, you can schedule send. Like I'm the type of person, when an idea is in my head, I need to get it out. So schedule send is a lifesaver. I mean, the telehealth is great so that if when my EMR goes down, I can jump on to Spruce's telehealth. Like there are so many ways that having good technology working in your favor make a major difference, so that you don't have to constantly feel like you're like disjointed, because your clients feel that too. If you don't really have a system in place, your clients are also going to experience that chaos. And we want to try to make our clients' experiences as comfortable and easy as possible, because they're the ones that are coming to us struggling. We don't want to add to the struggle by not having our systems kind of down pat.
Yeah. When you onboard a new client, I don't even know if that's what you would call it in your space, but when you bring a new person on board, do you tell them straight out, hey, I use this communication app and it really makes life easier? Like, how do you get folks in that fold?
Yep. So we just let them know that it's HIPAA compliant. It makes their life easier and it protects their information, which at the end of the day is the most important thing to me. Whether I'm using a HIPAA compliant email, telephone system, whatever the case is, protecting client content and information and health information is crucial. And I know some people who still, and I'm not calling y'all out in the crowd, but like use their AOL email addresses or like use their personal phone numbers. And again, that's just another form of burnout, right? Not the AOL piece, but if you're using your personal line, you don't really have separation from work. And that means calls are coming into your personal number. That means clients have your personal information. Like there's got to be checks and balances here. And onboarding is easy. So our admin just tells the client, I'm going to send you this link. You download the app with it for secure communication. And that's how we communicate in the practice. It makes it a lot easier than saying, this is how this app works. Think about if you want to download it. If you do, let me know. Like it just takes all the pressure out of it and makes it easy for the client. So our process is literally phone call or text, become a client. We're going to send you this link, download the app for secure communication, because that way we can start to have conversations in a HIPAA compliant and encrypted way. And it just ensures that the client feels protected. And some clients are going to say, I don't care, like just text me, SMS text is fine. And, at the end of the day, I just want to make sure that we're informing them of the protective factors that we can put in place, and also the risks that come with not opting into that.
That's great. That's great. Thank you for touching on that. Jess, do you have some questions that have come in?
Yeah, well, since you just touched on that, someone had a question. Some people had some questions about Spruce as well. So I just wanted to kind of clarify, we're still halfway through. We're not covering as much about Spruce today because we're going to use Patrick and all his amazing resources from him developing his own practice to help you guys do the same. But we do actually have a webinar next month that we'll advertise at the end that is about how to manage your Spruce practice. And it's 100% about how to use Spruce. So that's going to be great for those people asking about that. But someone did also mention, like, what's the difference between secure and non-secure, and about email and non-secure. So I just wanted to quickly touch on that because you mentioned it. So HIPAA compliance is a complex, regulation, and we actually have a whole white paper on how to use Spruce in a HIPAA compliant way. With email, there's encrypted secure email that, such as hush mail and some other ones that are encrypted. And then there's normal email, and normal email is not secure when it's being sent. It may be stored in a secure manner, like Spruce's email is stored in a secure manner, but once it leaves Spruce, we don't know if it's going to an AOL or if it's going to a secure email. So it's not a secure channel of communication. If a patient wants fully secure communication, we recommend that you use Spruce app-based communication. So that is where they are going to download the app, and it's going to be, they have the Spruce app and you have the Spruce app. So it's completely secure and encrypted between the two of you. However, you can also be HIPAA compliant and use non-secure channels, which is the very confusing part. And non-secure channels, again, are like that email I talked about, or SMS, which is traditional SMS texting. If the patient prefers those non-secure channels and says they're okay with the risk, then you are being HIPAA compliant. I could have an entire 4-part series on this information for webinars, but because there's so much info. So what I recommend is checking out our white paper on HIPAA compliance. We'll include it in the follow-up email because there's so much nuance to email, to fax, to SMS, to phone. But with Spruce, everything is stored in a HIPAA compliant manner. So you have storage and transit. So a lot of fun detailed stuff there. But so please check out the link that we'll send you in the follow-up email with the recording of this webinar. And anything to add there, Patrick? I know it's a confusing topic, but you seem to get it down.
No, nothing to add. I'm just looking through all the questions that are in here.
Oh yeah, but there's so many going on.
Good. Yeah, Patrick, if there's something in there that you want to address right now, feel free to jump on it. Otherwise, I'll just kind of keep us moving and we can keep looking at the ones that come in.
Well, one other question, actually, that's relevant. You mentioned, like, if you have your personal email or your personal phone and you're using that instead of using a separate service, that's kind of how you can get burnout, because you're not separating the two. Yeah. So obviously, some people don't know Spruce, that maybe not using Spruce on this call. So Spruce is a second phone number. It's a business phone number that you can use on your personal phone. So you can prevent, having just one number that's for both. It allows you to have 2 numbers, one for business and one for personal, but it forwards your personal cell phone, and you can adjust when it forwards or when you get notifications or auto reply, so you're not getting texts all the time. So it really does that separation. So 100%, I think, Patrick, you would agree, recommend getting a separate phone number than your personal number for using for business. Am I right?
Always, for sure.
Okay. Yeah. All right. That was the other one I just wanted to address real quickly, because it's a really important one I find when I'm coaching as well in selling Spruce.
That's a good one. Thanks, Jess. Patrick, did you see anything else you wanted to address right now, or shall I keep us going?
I mean, there's so many in here. I can basically answer all of them, but we would need to literally pause and answer all of them. So it's really up to the two of you.
Well, so I think what we'll do is we'll keep going, because we actually have earmarked time at the end to just have at it. But if you see something come in that's super relevant to like what we're talking about right this very moment, then feel free to jump in and answer that.
Sure.
Perfect. So segueing next, I always think this is great. What I thought would make me productive is work all the time. What actually makes you productive is sleep and eating well and all the other things that go into making life tenable. And that's a nice segue into this slide, which is, and we teased this out, of course, at the beginning. I mean, how can therapists work more flexible hours, take vacations, and of course, use their skills most effectively? Patrick, loving to hear about this.
Yeah, I think we have this internalized capitalism mindset of like, I've got to work 40 to 50 hours a week and work myself to death. And the reason you make the leap from an agency job or group practice is because you don't want to do that anymore. But I often see a lot of clinicians recreate their agency settings in their own businesses. I always recommend trying to work 4-day work weeks, if at the most, because some of you just can't handle absorbing more energy than that. And some of you need to work 3-day work weeks. So in order to really figure out like, how can I make this happen? You have to do some calculation, right? Like you have to know the numbers you need to make in a year divided by the hours you want to work and the weeks that you want to work. So if you can't do that, it's really like you're just throwing something against the wall to see if it sticks. And that's how we also need to determine our rates based on like, how do I want my business to run, not the other way around. And we so often just have this misconception of like, I'm just going to scroll through Psych Todays in my area and like pick a number. And that doesn't work because everyone's situation is unique and everyone's situation is individualized. So, I really do recommend trying to work 4-day work weeks and figuring out like, okay, if I'm going to look at a 52-week year, how many weeks off do I want to have? How many weeks off do I want to build in for PTO, sick days, mental health days, trainings? We have to know this because otherwise that's when we start to see clinicians say, oh, summer slump is here. I didn't save enough. Like now I'm screwed. So essentially, if I want to work, let's just say 42 weeks a year and take 10 weeks off, I need to know how much money I need to make in 42 weeks to make me survive for 52. So we just have to know that. And we have to really understand the money behind it. I always like to tell clients in advance that I'm taking time off, obviously, except for sick and mental health days that come up unexpectedly. But I have that language in our informed consent. Like, we are going to be taking vacations. We will let you know when that's going to happen. We have crisis numbers available for you. We have resources available for you. If you feel like you would like to work with a clinician who takes less time off, please let me know so I can help provide you with referrals. But I see a lot of clinicians struggle to step away. And I've even unfortunately heard many times, I can't leave because my clients need me. And I have always had the mentality that I am in this position to work myself out of a job, not to maintain years and years and years of a client interaction because they are dependent on me to function. Now, obviously, we have different acuity levels, but that's why we also need appropriate referral sources for different levels of care. So it's really important to try to figure out, what do I want this to look like at the forefront? Because you can dig yourself such deep holes where it's really hard to get out of when you've committed to like hours you don't want to work or hours that no longer work for your lifestyle, but you're concerned that if you tell your clients, you're going to lose them. Oh, go ahead, Gary.
No, I was just agreeing with you because I'm wondering, how do you manage your clients' expectations? And to be perfectly candid with you, I know that when I have been in therapy in the past, I'm always like, oh my God, you're taking a vacation? What do you mean you're taking a vacation? It's hard for the client to understand that you have a life and that you're not just there to serve, me. So how do you do that? And how do you get people to understand that these are your hours and, and these are the times you're not going to be around? You did mention that, you can refer them out, et cetera, but say that they're fairly committed to you. How do you just kind of level set?
I've taken 12 weeks off a year. Well, now more because my therapy caseload is now at like 2 or 3 with all the other things I'm doing. But I've been taking 10 to 12 weeks off for the last couple of years. And it was just about transparency and consistent communication about when these things were going to happen and why they were happening. Because if I can take the week off every month to recharge, I can be a better clinician. I can show up for you. And clients understand that, but we have to have these types of conversations. We tend to shy away from them. And then it becomes this paradox of like, ooh, I haven't talked about this. So now when do I talk about this? And then you start to almost guilt yourself into not doing it, or because you haven't done it. And just the ability to say, this is modeling healthy boundaries and behavior, right? Like if you're showcasing to your clients that you're taking care of your own mental health and that you're stepping away, that is really modeling healthy boundaries and saying, I'm a human too. Because so many of us as clinicians get into this mindset of, I can't also be a human too. I can't curse in my content. I can't take vacations. I can't, wear shorts to work. I see that all the time in Facebook groups. I'm always confused by this, but nevertheless, it's just, we really do create this situation for ourselves because we've been told in grad school and community mental health jobs that this is what being a clinician looks like. And just to take it one step further, I hosted a retreat for private practice therapists this weekend in Asheville, and we went on a bus tour that had a band on the bus. One of the band members is a school psychologist, but this was an additional revenue stream and an additional way to use their creative talents and make money, but also use their other parts of the brain. And I think clinicians so often lose sight over the fact that we are creative. We have all of these skill sets that are applicable elsewhere outside of 60-minute increments of our time. However, we only seem to hyper focus and have tunnel vision around that, saying the only skill I have is holding space for 60 minutes. And that is just not true.
Mm-hmm. Yeah, I think that's incredibly valuable. The one thing too that I want to touch on is, you just mentioned that you were on this retreat, and I know that you do these throughout the year, and that must give you an opportunity to get that pulse check and to reconnect with your peers and to, exchange ideas and ultimately connect with your people, right? And so what about for those therapists who may not have that outlet? I mean, it must be fairly isolating. What would you suggest in terms of not having them feel like they're on a little island all by themselves?
Yeah, great question. Private practice can feel very isolating. Mm-hmm. And I think we can also get into this comparison mindset of, ooh, everyone else is doing these things and I'm not. And what I would say is, one, to address the retreat thing and all the vacation time, my career did not start this way. When I started my private practice, I was doing all the things that I'm telling you not to do. And it was learning from those mistakes. However, for those of you who really can't step away in that regard, you still need to step away. Don't get me wrong. It doesn't mean you have to leave town and go do all these other things, but you need to step away. But having some consultation group can be really, really important. I mean, having groups of therapists and peers where you can bounce ideas and get consultation and process things that you experience, because we don't have the type of job where we can go home and tell our partners or our friends about what we did that day. We are absorbing energy all the time and holding space and taking it in and keeping it private. And that takes a toll. So you have to have an outlet, whether it's a hobby or a peer group or a consultation group. My friend Catherine runs the Teletherapist Network, and it's a great way to have online peer consultation because there are all these different therapists running consultation groups on different topics, on different populations, lots of peer support. I just think it's really crucial in this profession to ensure that you have people in your life who you can also bounce ideas off of or just talk with. I remember when I was in private practice, I would see clients, I would leave my office and I hadn't talked to anyone that wasn't a client all day. And that is pretty isolating. So I do think self-care, again, does not have to be glamorous, but it has to be something. There has to be some self-preservation what's the word I'm looking for? Mechanism in ensuring that you are taking care of yourself.
Yeah. Yeah. I think that's critical. And thank you for that. Because we have about 15 minutes left, I do want us to now get to all those wonderful questions that have come in for you so that people feel like they've been able to connect. Jess or Patrick, do you just want to cherry pick?
I saw a couple themes. So I think there's like enough questions about one theme. A lot of people are on this call thinking about starting a new practice or really trying to grow. Mm-hmm. So do you have any, a couple, like one, what's it like to bring on the first clinician? Kind of growth by adding clinicians. And then the second is actually, how do you grow to have more clients for everybody? So marketing questions. So you can choose what you want to address first.
Three different topics.
Yeah, I know.
So bringing on your first clinician, I always want to ask coaching clients of mine who want me to help them start group practices is the why behind it. Do I just want to bring a new clinician on because I'm so busy that I want to refer in instead of out? Or do I actually want to be a boss? Because if you do not want to be a boss and supervise people and be a leader, group practice ownership is not for you. And I have that conversation a lot, and people really have to take a step back and think, what is the reasoning? If you want to just make more money, there are other ways to make more money that don't include hiring someone. If you want to be a boss, great. Then group practice ownership is probably for you. You have to then decide, and this is a whole rabbit hole of 1099 versus W-2 and pay splits and benefits and all those things. But I would be working with my accountant, provided that you have one, and you should have one, is how much money can I afford to pay someone? If we're looking at our finances for the year or last year, how much money can I afford to pay someone to bring someone on? And then you can start to open up some space in your schedule so that you can focus on other ventures as well. And it's cool because if you hire a clinician, you can then transition clients off your caseload, provided you inform them and have that process. And then you can start filling your own clinicians' caseloads. I always say, here are some names of people outside of our agency, but here are names of people who work in this group practice. So, you can have it be two-folded, and that can be really great. Next question was, how do you get more clients for your group practice? Is that what it was?
Yeah. And like, what tools do you prefer to use for marketing? Like, what's the most important for social media? Or, you mentioned something about creating like a bio and stuff like that. Like, what do you use? What do you recommend?
For sure. Okay. So, I mean, the two things, this is such a complicated answer.
I know.
I wish we had more time, but like, there are so many things you can invest in, and you should invest in one of these four things, and multiple if you can. A great website is crucial, followed by great SEO on the website. That means you're being found in Google searches more often than not. There's plenty of people who do that service. Google ads can be very helpful as well. And then coaching or mentorship. Those would be my main answers to that, because guidance and support are crucial in your business, just like they are in your clinical pathway. So just having someone help guide you and put you in the right direction, whether that is an SEO and marketing person, a coach, whatever the case may be. But I think that's important. Niching down, also important. If your group practice has a consistent niche, crucial, because then you will become known as the group practice in town who specializes in population A, B, and C, ensuring that you are getting more calls. Constant social media content is really important too. Blogging, really important. Using Canva for cool social media posts and graphics can be really easy. There are lots of services that will auto post for you so that you can load up a bunch of content and it will post for you, so you don't have to do it every day. So lots of ways.
Yeah. And I noticed too, Patrick, I love that you are so active on social, and I get your emails every day. And I think that must keep your audience very engaged, because it's always fresh content and it's always something new. And I'm always eager to see what you're sending over.
Thank you. Yeah. It could either keep them engaged or drive them away.
Well,
both can be true for sure.
I was going to say that's funny and not funny, of course. I mean, how much is too much, right?
Yeah, I think that the 80-20 rule is really important. So 80% just being helpful, informative content. And then if you are in a different capacity where you're selling something, the other 20% being the sales piece.
Okay.
You don't want to beat people over the head with like, hey, buy my stuff. Hey, buy my stuff. Hey, buy my stuff. That's a quick way to get an unsubscription or an unfollow.
Yeah, of course. That makes sense.
So there's some questions about coaching and like your resources that we'll go into at the end when we share your link to your business.
Sure.
But there was a couple questions about, you mentioned like you just charge more to your clients, and somebody else said I'm just starting, and I'm doing full self-pay, or should I do a sliding fee? Any just general comments on how much you charge your clients if it's self-pay?
Yeah. And I also saw one that said, how can I charge if people can't afford what I want to charge and increase? So again, complex answer. I'm going to tackle the 180 to 200 one. What if clients can't afford that? Mm-hmm. Some of us are in areas where that certainly is not possible. Clients can't afford it. But again, with telehealth, you can work throughout the entirety of your state. So it's important to recognize that you do not just have to market to your area. I have several coaching clients in rural Oklahoma, Alabama, one other state that I can't remember, and they are charging $250 an hour in full, but they are very niched. Their content is great, and they're very active with their marketing. If you're not doing those things, very hard for you to raise your rates. And raising your rates does not mean everyone on your caseload is going to pay them. And it also means that you get to decide what kind of sliding scale you want to have, if you do want to have a reduced fee, and how many spots you want to offer. That is completely your call. So if you're feeling like raising my rates to 180 or 200 isn't possible for my population, there are other creative ways to make revenue that doesn't include just seeing therapy clients. One quick example, if anyone listens to my podcast, I had a Jetta Robinson on last week, who is, I'm a huge fanboy. If you don't know a Jetta, she's amazing, but she is an 8-figure BIPOC business owner in Maryland. And her take on what if people can't afford me, she wrote a book that now millions of people have access to for $15 that helps them out. So there are lots of creative strategies to support people that don't always include charging for fee for service. As for the sliding scale question, you get to decide. Again, this has to be a calculated and intentional, thought out process. You really have to ask yourselves these questions. How many weeks do I want to work? How many hours a week do I want to work? Then you have to figure out, how much money do I need to make? How much money do I want to make? Very different answers. The money you need to make to pay the bills is very different than the money I want to make so I can do A, B, and C. Then we just have to understand that. And then you get to decide, like, you do not have to base your rates on anybody else or what they're doing. You need to base them on what works for you. And that includes, do I want to take a sliding scale? Do I want to offer reduced fee spots? How many do I want to offer? That is completely up to you. And no one person can answer that. So it really does depend. I have friends that have a pay what you can model. I have friends that don't do sliding scale at all. Like, it really does depend on your own unique situation. And I know that's not the answer you're looking for, but that is the answer.
Mm-hmm.
What else you got, Jess?
All right. So what would you say is your number one social media tool? Is it Facebook?
It's a good question. So
Email?
for my coaching business,
you have a podcast, so that's also hard.
Yeah, I mean, it's hard for me to say that. I mean, it depends on who your audience is, and that's really important. If your audience is like professionals and executives, you probably want to post on LinkedIn. Mm-hmm. If your audience is young adults, you probably want to be on Instagram. Facebook is still useful, but it's less useful to get therapy clients. I have a Facebook group, All Things Private Practice, but that is very well nurtured and maintained and moderated. So we have a great community. Then I would say like TikTok, like, y'all, I know some of you may be thinking like, I don't want to do it, but so many therapists on TikTok, like filling their practices by giving out very valuable 30-second clips of information and allowing people to, again, that's free content and information for clients, right? That can't afford your services. 2, therapy clients in your state see those videos and are like, I want to work with this person. I have a podcast episode with Jeff Gunther, owner of Therapy Den, about his TikTok following, 1.5 million and counting.
Wow.
Just by giving out good content all the time.
That's incredible. Are you going to venture down that path, Patrick?
I have a following, but I don't want to become Jeff Gunther on TikTok. I love Jeff. I don't want 1.5 million followers and comments. And that means you're doing it every day, all day.
Yeah.
I can't do that. But my podcast is a big platform. And then, y'all don't have to be in every space. I think that needs to be said. And you shouldn't be. You should just really be thinking about, like, where does your client spend their time? And creating good, authentic content, not just resharing and reposting graphics. Like, this is what self-care is. This is one strategy to do A, B, and C. Put your voice to it. Like, talk about why that resource works. Talk about the importance of X, Y, and Z. Don't just reshare other people's stuff, because that's going to get clicks to their stuff, not to yours. And you need to be able to put your own authentic spin on everything that you do.
Yeah, that is good advice. And Patrick, I want to make sure I leave a little time for you to to speak to some of these resources real quick. So please have at it as we reach the top of the hour.
Sure. Yeah. So if you are a therapist that wants a good Facebook community, you can join the All Things Private Practice Facebook group. It's really intentional about everything we're talking about right now and a lot more than that. My podcast is the All Things Private Practice podcast. It's on all major platforms. There are new episodes every Sunday. The main themes are the emotional sides of being an entrepreneur and therapist. So imposter syndrome, insecurity, perfectionism, failures, really trying to normalize and destigmatize mental health, a lot of topics on neurodiversity. I'm an autistic ADHD therapist and entrepreneur. We talk about that a lot. It's interview style. So I have a lot of big names in the therapy world and business world on there talking about their own struggles and failures and things they've learned, because they're trying to normalize the fact that when we step out of our comfort zones, it should be scary. But then these are the strategies to work through that fear. And then I do host private practice and entrepreneurial CE, MBCC, CE events and retreats. I have one in Ireland coming up in March that has 10 MBCC CEs. It's all inclusive. There are 2 spots left. And I have one in Barcelona next April that is also MBCC CE. And we have a little more spots left for that because we just launched it last week. I created a discount code for anyone that wants to join either of those events. It's in the chat, but I can put it in there again. But it's $250 off. There are payment plans. Lots of fun. We did Ireland in March during St. Patrick's Day. We did like a group tour to Kilkenny, then at St. Patrick's Day parade. We hired live musicians to play at the venue, business coaching. Like, it was awesome. And we're going to do the same thing this year. And then we're going to do the same thing in Barcelona, just with a Catalonian twist to it. So looking forward to both of those events. And here's one thing I want to say real quick. When I left my community mental health job, all I wanted to do was leave my community mental health job. I had no idea where this career would take me. I thought private practice would be the finish line. I did not foresee my career turning into what it's turned into. And I think that for all of you listening, that can happen. It's just a matter of getting creative and stepping back and giving yourself enough space so that your brain can think about what else would you like to do. And for some of you, private practice is the finish line, and that is also okay. So it's just really cool to think about the fact that, like, I didn't foresee a podcast and retreats all over the world and a group practice and a Facebook group. Like, that was never a possibility. So my motto has become doubt yourself, do it anyway. And I really think that has been really important for me.
I love that. That is incredible, Patrick. I do wonder though, when you find time to sleep, but I think it's incredible how much you've got going on and how you've really just built this incredible thing for yourself and for a lot of other folks. And hopefully our audience today has been able to obtain a better understanding of how you have been able to transform your work and so many others with basic tools and techniques. I think this has been incredibly eye-opening, and I'm so grateful that you joined us today. Real quick, since it's 12 o'clock, I just want to tease out, Jess mentioned at the beginning that we do have a webinar next month focused completely on practice management. And you can learn hands-on how to use Spruce as a supervisory and training tool, how to create consistency across patient communications, harness the power of transparency, and tap into detailed reporting to really guide the growth of your practice. So please do join us. I'll include that information in the email that I send out later this afternoon. And if you're still with us, we have a blooper for you. For those who stay till the very end, our own Jess could not resist an opportunity to one-up Patrick in what can only be described as the chair that she is most comfortable in. And with that, I want to say thank you both. This has been a great session. Really enjoyed our time today, and we'll be following up with everybody later this afternoon.